So this is how I check this mobility. We're talking about mobility, thoracic mobility, but also we're gonna treat her pinch, like a pinch nerve. What I'm looking for, it's a thoracic. We already did tests, remember, on her. She don't have any mobility in her thoracic. She can't even turn. If you guys want to repeat this test, come up, let's do it again. So come up here on the table. And table is much better than table. So remember, the customer, if you check this right side, you're standing on the left side. And what you do, you ask her to like drop the body down. Put the arm together. This is the most important part. Arms always together. Legs can be separate. She shifts her weight down. Now she's placed her arm on the back. Shift her head. Try to turn and try to turn. Make sure she's not shifting. You see, I'm kind of support her so she's not going anywhere. This is not 45, so go ahead, make a picture. And now I try to help her and see if I can go. No. And I don't want to push. Let it go. So we know we're strong guys or girls, but we don't want to push. Now we check this side. So I come up here from this side. What I'm doing, I'm block her from the move her hips. Okay. Now she's placed her hands on the back. The left arm. Sorry.
Oh, sorry. I was trying to her arms.
No worries. And now try to shift it. And I try to help. And it's nothing up there. So it's a motor control problem in thorax area. Now sit down, sit this way. Let me turn AC a little bit down. Go ahead and place your arms on your, like this way. So if this is the big person, yeah, make a picture of this. If this is woman or you woman, which is you are, so you guys put the pillow right in here. She can place her arms on you, shoulder, and look what I'm doing. I'm checking her vertebra is working, so I'm checking extension right there. You see what I'm doing? I'm doing it in the spine. And I'm checking rotation. So what I'm doing right here, I feel it. It's a little bit kind of push my finger out. So I can go all the way up, or, which is I like it too. She plays her like this, cross, and she plays on your shoulder too. And in this case, you can go a little bit deeper. You see, you don't need to pillow in this one. So you check all those vertebrae. You want to do rotation, you check rotation right there. I feel on the left side, it's not working. Okay?
How do you feel? It's more stiff?
Yeah, it's like pushing your finger out. This is another way. So what we can check rotation, bending, extension, but this is the best way, I believe.
Her posture already looks better.
You put your fingers up here, and this is my favorite one, my preference. I come up here and I hold her, and in this case, watch. I sit up on the table and I do fingers like this. So same thing, very slowly, and this is also the treatment. She can push against me. Go ahead, push against me. Let it go. What do you feel? You feel good? Okay. This is also treatment. Push down and let it go. Same thing. Immobilize the left side now, right?
Can you look? Do that one more time? Yeah.
If I want to switch, I'll start doing this side. I come up here, hold it, and do this side. And this, it's no movements here at all. I'm gonna record it. Good. How you guys feel it? Yeah, gets his arm a little bit more up.
Try to understand.
Just don't Practice, practice, make it perfect, right?
Very high art skills.
Don't push so hard. Don't push like with finger, like watch. This is the laminum groove, so you will find a laminum groove right in here, right? And this is what you do.
Yes, that's.
And you see if any something pushing against your fingers. If the push, yeah, this is the problem.
Yes.
You can just add a little bit of rotation, okay? I'm not pushing so hard. You don't need to push so hard. Yeah, you just kind of try to lock those faucet backs. You guys
That's
doing
probably
good?
because it's all locked up.
Yeah, you need to work. You, 3 of you guys, really bad. Well, I'll show you exercise.
Sorry.
You don't need to do what? Sorry, you don't.
I'm not in the club.
You have. No, oh, here we go. You feel that? That was actually a good shift for her. Okay? Or it's another one, working on those erector muscles and mobility. You come up here, she put this hands on the shoulder, same thing. You right in here. If this is woman, it's fine. You push the little breast down and you work, use your palm. So you do, and I take you to the first barrier. It's right in here. And now I ask you to resist me. Go ahead, push, resist me. Kind of, she try to rotate back and let it go. And I get some little bit more. So I'm not trying to crack her. I'm just get some little bit more. No, I can't crack. I'm not a chiropractor. That's not the goal. So you see, we get some more rotation. Perfect. Now I switch the side and work on that side. Perfect. Come up here from this side, from the back. Completely from the back, yeah.
Let me see.
Mm-hmm.
Let's try. Let me see.
Place her hands
Right there,
on
sure.
the abdomen groove.
Why not?
And now, add rotation. Rotate her first.
Resist me. Resist. And relax.
Make sure she's not collapsing. You see? She's collapsing here.
Both of them are two big guys.
So look what I did. I put her in extension first, and after I start
Oh,
crooked.
yes.
Right there. You feel?
Yes.
Yeah. Oh yeah.
Oh, crack.
Yeah. Sheep crack now.
To put the extension.
Extension first. She can be rounded. Yeah, she can be
Yeah,
rounded.
take it in the picture, please. They are so funny.
Yes. No, they're not funny. They break
resist?
good. So yes, take him to extension
More than
first.
this way. Resist?
There we go.
Yeah.
You guys need to sit
Okay,
on
relax.
this side.
Oh,
Let me show you.
and flexion.
This is how I'm already in the back of the client, so ask him to hold. I come up here. I hold him. He's not going anywhere. Now I can put him a little bit in extension and start adding rotation. Oh, here we go. Look at that pop. Go ahead and rotate back, rotate, and let it go. What I'm doing in this exercise, I activate all his muscles around like spine. Rotate back and let it go, and I take him to the next level. And you see, we create more mobility. I want some here. I'm gonna get a little bit extension here, very gently. If she's not moving, if he's not going that way, I'm not going. I'm not
I can do from other side too.
She have to be straight first.
Yeah.
Yes.
You want me to?
You go and get this arm right in here.
You want me to go?
From
You want me to be
shoulder or
turn
what?
around on the
Right
other
here.
side?
Down. And if she start feeling any tingling, numbness, it's really gently.
Are you taking clavicle?
Yeah, it's right on the clavicle, right there. So she feels something?
It's good. I feel good.
Do you feel any?
But I feel tension here, very
got
much.
camera up
Yes,
there.
here, tension.
I'm sorry.
Too much tension.
Yes. So it could be scalion's problem right there.
Yes,
Now shrug your shoulder and let it go.
yes. Oh, too much tension.
There we go. So this is I'm holding and ask her to do this kind of stuff. And shrug your shoulder, shrug the shoulder, and let it go. Okay, let it go. Let it go. Only shoulder or neck. So
So she feels it on her clavicle?
now come up here. Look what I'm doing.
It's a clavicle, huh?
Yeah, clavicle is right here. But like I said, this is a lot. It's a danger zone. So this is the scalenes. You see the vein has come right in here. And the nerve, you don't want to do. You can be right in here,
Yes.
and I really
Scalens,
gently.
it's down. This scalens.
Yes. Some people do it this way, but I don't know. They come up here. I don't remember. They kind of come up here and they grab right in here. So they lift this clavicle up and ask you to do this. I don't know, right there. Yeah, I can. How's it feel?
I feel it more from here when you did it. I always want to crack
Very
my
gently.
neck,
This
you
is
know?
super
I
gently,
always
guys.
crack.
No,
Maybe
very
that's why.
gently. Move very gently. The head is, you have to really super gently because you don't want to mess with this. So this is the first rib. You know, it's a clavicle bone and rib right in there. And it's possibility for her, that first rib pushing on that. Very gently. How do you feel? Talk to him. How's it feel?
What? It's okay.
Do you feel any tingling, any numbness?
No.
Good. Good. Shrug your shoulder. Like, no, just a head stretch. Shrug your shoulder and let it go.
It's a little fast.
Yeah. Right in here, guys. This is the first rib, you see? This is the first rib. Sometimes, this is what they start tingling and numbness. Sometimes that first rib, they push on that clavicle bone and that push on the push against the nerve, and it feel all the way down. So that's why we're doing this. We push that kind of rib a little bit down. You see, this is rib right in here. So we push this rib down.
Yeah.
So, guys, this is really cool. Most people, they sitting too much at the computer desk. They don't they completely forgot the motor control problem. They don't remember what's to go first. But the ideally spine go from the neck and all the way up to the vertebra. And same thing, you're going up. You stuck those vertebrae up. What's happening with people? The neck goes separately, everything goes separately. Remember, the cervical, it's a stability, right? So now, I want to teach them and also work at the same time on all those muscles and activate thoracic, put it all together. So what I teach them, what I explain it to him, I teach him to lean forward all the way down and slowly all the way up. So, and I teach my customer first. The neck is tuck the chin first. After you go around your upper body, lower body, and try to go as far as possible. So he's still open the space. He's stretching this muscle. He stop right there. Take a deep breath, couple breath. I teach him how to breathe now. Okay, you see, he's kind of go this way. Put his elbow way. Maybe he have some breathing problem now, because you see he start breathing and his arms go up. So now I teach them. You see, he's going with the neck right away. I teach them to go with the lumbar area first. Lumbar area first. Lumbar area first. Now watch. Chest. I teach him how to get chest up. Chest up. You see neck has come? I hold it right there. Chest up first. And now he get that head. Now I'm going to apply my pressure. And what I'm going to do, I'm going to ask him to do this. Like start doing the same thing what we've been training. I'm applying my fist here, and he started doing this. I'm going on the top. This is used to bench or electric table. This is great. And I'm going all the way down. I'm not pushing on the spine. I'm staying on the erector. Look at this. Now, you see, I'm start hurting myself because I'm shrugging. I'm changed to my forearm, and I go all the way up here, and he's going slow down. And I feel So let's do it again. Let's put her in neutral position, heads up. Look at this way. Now slowly your head is go down. And you see, yes, I put too much oil, that's it. I'm slide off. But stay there, stay there.
What she said?
She said very good. Okay, step right there, hold it, don't go anywhere. You tuck your chin, you see, I teach her tuck the chin. Now from here, I wanna work on this area. She's super rounded. What is it, pain?
But aren't you rounding her more?
Huh?
Aren't you rounding her more?
No, well, you'll see right now. I teach her. I activate all those muscles.
The tightness is going on.
If it's too tiny girl, I use one arm. I'm doing this. But I keep her in this position. She's tiny, I can use my one arm. Now try to get some more. Stay there, stay there. Now, when I work, just keep take a couple breath, deep breath, deep breath. No, you see, her head does go up. Okay, now I add a little bit movement.
So what does that mean?
She's not functioning right. The brain is not functioning right. So now we're gonna go up. Now we go up slowly. You see, she's going with the head. Head is down, and I teach her to get to work spine, 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 spine. You see, and like right in here, I come up here, stay chin down. Now chest up, put the chest up, chest up. Yeah, we teach her. Now, when she's up, her neck is gonna go up. And it's not working right in here on the left side, completely. Two massage therapists here. Yeah, so here I found my T1, C7 right in here. I'm apply my 2 thumbs. You can do V, but I like the kind of knuckles and thumbs. And I start pushing down and ask her to raise her head up and tuck the chin. And this is what I do. You see, I use my body weight. I don't use my arms. I found that laminum groove right here, so I feel comfortable. I feel stable. Now I'm asking her to raise again, and you look. I use my back leg and I push with my body down. It's probably 20 pounds now. I don't push too hard, but it's 20 pounds. Also, you can work on those, because she have kyphos. I probably go all the way that spine like this couple times. On your case, I will never do that, because and I hope if you put too much oil, that's it, forget about it. You're not gonna be able to do it. But this is right here, and ask her to do the same thing, raise.
Oh, good. Oh.
And I'm not tired, I'm just use my body. I'm let it go. Gonna be too much, so I support, because I lean too much if I let it go, but I'm kind of leaning my arm and then this arm together. And I'm not hurting myself. I don't use my arm at all. That's why I stopped using it.
I need this technique. 1 hour. 1 hour only this. Oh.
Raise your head, raise your head, raise your head.
Oh.
That's it. Knuckles, I mean thumbs, yes, but it's just navigate me. But most jobbers come right here from my knuckles. Okay.
So what kind
So-
of grip does she have at her low back?
Quick stuff. Check, check. Activate, scapular, and what's the call? The laminum, yeah, laminum groove. Just you can work a lot. I come here with the shoulder. I'm just doing this sometimes. We'll mobilize the shoulder. She push it down, push down, let it go. I'm doing that kind of stuff too. Maybe scapula in. Work on this teres minors right here. Come up. So very gentle. It's sometimes really sensitive, but I will probably work on her pecs a lot.